Today we're going to talk about borderline personality disorder, which is a difficult disorder for the person who has it. This is the disorder that is, people with this disorder are most likely to go in, ask for help. We're most likely to see them in inpatient and outpatient settings. They're also very difficult people to be around. There's often a lot of problems associated with it. They often seem very needy and demanding. So I'm going to start today by talking about a client that I worked with. This is actually a composite of several clients. This woman was very bright, doing well in school and also doing well at work, but had a lot of difficulty in her relationships, a lot of mood problems. With me, she idealized me in a way that I'm not perfect. And also, sometimes she'd get angry and say that I didn't care, never had been there for her, didn't want her there, which clearly wasn't the case either. Part of what you hear here is, some of the difficulties with interpersonal relationships. She often felt abandoned. One of my clients, I canceled an appointment because I had another client in crisis, and she came in the next week, saying that she intellectually knew that I hadn't done so, but that she felt abandoned by me. And I was very thankful that she told me this, rather than just acting on those feelings. That really indicated where we were, in therapy. A lot of problems and moods, as you can tell. Certainly if you feel abandoned, that's going to cause a variety of different sorts of problems. Problems with identity. Generally, when I'm talking with people with this diagnosis, I'll ask them about goals and values and where they want to go with life, and they have real extreme difficulties with knowing or being able to answer those things. Those difficulties are often true for high school and college students, not as true for older adults. Often they're engaging in problem behaviors. So they may be binging and purging. They may be using drugs. Often a lot of thoughts about suicide and a lot of self-injury. And we'll talk about self-injury some more in the next video. I'm encouraging you to look at this in your book, but notice that this is a pervasive pattern. It's not just with one person, but you see it across a variety of contexts and really affecting a good part of how this person interacts with others. At least 5 symptoms. Some facts. Again, some ranges in terms of numbers, but most frequent of the personality disorders, problems with moods and relationships and coping and thoughts, lots of suicidal behavior and thoughts. More likely to be female. Lot of histories of child abuse, again with retrospective reports, particularly from people who perceive even helpful people as wanting to get rid of them. It's sometimes difficult to interpret this. We've already talked about inpatient and outpatient settings, problems with serotonin and with dopamine. So therapeutically, problems with self-worth, problems with coping, relationships, trust. Those are things that often show up in the therapy room and that we're going to want to work with. If you're looking for a movie about this disorder, think about Fatal Attraction. This is Glenn Close and she does a really nice job portraying some of the real difficult parts of borderline personality disorder and their relationships. I think it's important for us to keep in mind strengths, and my feeling is that the people with borderline personality disorder that I've worked with have also been kind and generous and empathic and insightful, even though their insightfulness tends to be primarily about the negative parts of themselves, or about, their empathy tends to be more about the ways that people are wanting to reject them rather than the ways that people feel close to them. We're continuing to think about this multidimensional causality. Think about the biological pieces, genetics and neurotransmitter pieces. Think about the early family problems. So often people with borderline personality disorder and the other cluster B or dramatic disorders have real problems with family, a lot of child abuse, a lot of neglect, a lot of alcoholism, a lot of stressors, abuse, trauma, family conflict, a lot of cognitive problems and behavioral vulnerabilities. So we'll talk about some of the cognitive pieces in a bit. There are also problems with emotions, impulsiveness, and all of these things lead to the cluster B disorders. Different disciplines describe borderline personality disorder in different ways. So, for example, and you might go back and think about the story of 4 blind men who are seeing an elephant for the first time. And one sees the elephant's trunk and says it's a vacuum cleaner hose, and another feels the leg and says it's a tree trunk, and another feels the tail and says it's a rope, and another feels the ear and says it's a palm leaf. Similarly, psychologists of different orientations see different parts of borderline personality disorder and sees them accurately, but they're approaching them from different perspectives. So a psychoanalyst looks at the ways that people tend to see their world in black or white ways, good or bad, and how these reflect some of their relationships with important people in their lives. Psychopharmacologists look at the problems with serotonin and dopamine. Cognitive therapists think about the faulty ways that they think about their worlds. And dialectical behavior therapists focus primarily on emotional dysregulation. So some of the typical cognitive distortions include that the world is a dangerous place. And imagine if you believed that the world was dangerous, how that might impact the way that you responded to people around you, that you might be looking for ways that they were going to hurt you. That they often believe that they're powerless and vulnerable. And if you feel powerless and vulnerable, you sometimes have to attack before other people are going to hurt you. I'm inherently unacceptable, and if you feel unacceptable, then that's going to impact your moods. It may not prevent you from engaging in dangerous behaviors. You may wonder why someone good might choose to be in a relationship with you and might expect that they're going to reject you. Medications are used to reduce anxiety and depression and to stabilize moods and to reduce psychotic symptoms. So we're looking at antipsychotics, anxiolytics, and antidepressants. Dialectical behavior therapy is a really interesting and important approach to working with people with borderline personality disorder. And it focuses on issues of safety, first, so decreasing suicidality, increasing mindfulness, and developing other strategies for coping effectively with difficult issues. So learning how to regulate emotions effectively. Second, explore past traumas and find new and better ways of coping with that. And remember that talking about trauma tends to be a kind of flooding, and we decrease the power of that trauma by doing so. And third, encouraging clients to value themselves and in the process to gain some self-confidence. Outcomes: less likely to drop out of treatment and less likely to make threats of suicide. So outcomes here have really been very, much more positive. So 20 years ago, people were really pretty pessimistic about working with this disorder. Throughout the semester, we're going to be talking about risk and prevention. And one of the real risk factors seems to be child abuse. And one of the ways that we can prevent that is by helping parents become better or reduce some of the risk factors for them engaging in child abuse, helping them to solve basic problems. I am having a difficult time at work and have had a real difficult day. How can I handle things better when I go home? I have a child who's screaming and won't calm down. How can I handle that better? Positive parenting. So rather than focusing on spanking, which only tells a child what not to do, remember from your discussions in developmental psych that what you want to be doing instead is focusing on positive strategies such as encouragement, using token economies, setting limits, warm limits, communicating well, rather than telling people or children what not to do. Developing stronger parenting skills, developing a better support network. There's an African proverb, it takes a village to raise a child, and certainly I think that is an important idea to pay attention to here. And anger management. So what can you do to handle your anger better? It's not that anger is bad, but let's use anger in an effective manner. So what should you do now? We've been talking about people who are making poor decisions. We all make poor decisions. When do you make poorer decisions? And what puts you at risk? And when do you make better ones? And when you can identify these things, first of all, you're going to be able to develop more empathy for people who are making poorer decisions. But you're also going to be able to help them to make better choices in their lives. And take care.